Folks, this is a fun interview. I've been looking forward to speaking to my friend Adnan Qureshi here. I have to say, just before we jump into the topic, which is going to be something that most of us aren't really intimately aware of, these so-called ambulatory surgical centers, which are already a big part of healthcare, but definitely growing and becoming more important, especially in their relationship with both healthcare systems and how they change that ecosystem for healthcare systems and hospitals, as well as for a growing movement of employer-based care. So this small thing called ambulatory surgical centers has a tremendous impact on how healthcare is delivered, quality, outcomes, et cetera. Super exciting. But before we dive into that, I just want to say I've known Adnan for a few months now, and he is a just such a wonderful, open, honest, high integrity person, and it gives me great hope for the future of healthcare when I come across people like Adnan Qureshi. Who are working in healthcare. You're not going to hear about him. Maybe he'll become famous one day, maybe not. But it's people like Adnan that really make me think we have some hope for the future of healthcare delivery and for health in general in our country and across the globe. Adnan, I didn't mean to embarrass you. I hope I didn't, but welcome to Creating New Healthcare. Could you just maybe just give a little bit of a brief bio on yourself and who you're working for right now, and then we'll just jump right into the topic.
Yeah, Deep. Well, thank you so much for that warm welcome and kind introduction. It's a pleasure to be on with you and spend the next few minutes kind of talking about something I'm very passionate about. And you call the ASC industry small, which it's definitely no longer as small as it used to be. And excited to kind of talk about what's changed there. I'll share a little bit about myself, and then I'll talk about Kaufman Hall and what we do. So I've been in healthcare for the better part of the last 15 years. Was just really passionate about the industry growing up. Was in and around the healthcare setting, both as a consumer, a family member, a patient, and really had an appreciation for care delivery and the entire process that was in and around it. So I kind of knew from an early age this is the industry I wanted to work in, and at around the time the Affordable Care Act passed, like many other people, really became energized about the industry and wanting to get involved, wanting to be a part of what's kind of fixing or improving upon what's a very challenging set of circumstances for a lot of people and a lot of stakeholders in our industry. So my first healthcare job was at DaVita, where I supported both their specialty pharmacy team and their at that point healthcare partners, which is now Optum Medical Group. So worked on value creation strategies, worked on contracting, worked on risk. It was a great place to kind of learn the ins and outs of healthcare delivery in one place, and it's rare to get the opportunity to do that. From there, I pivoted a little bit. I went to Houlihan Lokey, where I worked in traditional corporate M&A, all focused on healthcare, retail, ambulatory transactions, and then I kind of missed being around some of the people that I was with at DaVita, and I learned about SCA Health, Surgical Care Affiliates at that time, which was a publicly traded company doing a lot of good work. They were pursuing kind of the triple aim of healthcare, really resonated with me. So I spent 3 years working in corporate development there, and really learned the ins and outs of the ASC industry specifically. And then more recently, I came back to professional services really out of my own enjoyment for the variety and working with different clients and help people find solutions to the problems that they're trying to solve. And so Kaufman Hall is an advisory firm that's been around since 1985. Really started, and the DNA of the company is in serving health systems. And as the industry has changed over the past 40 years, so have the needs of our healthcare clients. And I'd say while we started with health systems, we now probably serve over 900 organizations in total,
Wow.
50 academic medical centers. We've advised investment funds. We work with payers. We work with independent groups. So entirety of the continuum is under our purview with respect to who we serve. And I'm on the M&A team where I work on a variety of transactions, kind of with all this types of stakeholders that I mentioned. And what I'd like to think and what keeps me very happy at Kaufman Hall is the opportunity to work with people that are as mission driven as I am.
Anand, thank you. It's interesting as I'm listening to you, someone could hear that and talk about, okay, mergers and acquisitions and transactions and finance and all that. And it's just, what I've come to realize is the devil is in the details. And, you can have all the verbiage, all the talk you want, but it comes down to exactly what you're doing. The transactions, the contracts, the finances, the business models, all of that is literally where the rubber meets the road. This is where healthcare delivery is being created and reframed. And so again, I'm going to double down on what I said before. I'm just glad that there are people like you, and I am familiar with Kaufman Hall. I think integrity and mission is really, really critical right now, especially in the world that you're in. So I just want to, again, thank you. Ambulatory surgical centers. So I said it seems like a small part of healthcare, and you corrected me and said, no, 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 Zev, it's not. It might have been years and years ago, and in fact, I remember when it was. And I remember talking about ambulatory surgical centers a few years ago, and saying that this is going to be huge. We need to actually jump into this in a much bigger way than we are right now. I was right, and I wish the folks I had been advising had listened. But tell us about so what is an ambulatory, for those who are not familiar with it, what is an ambulatory surgical center? Why did it come about? A little bit of the context to bring us to where we are today, and we could dive into what's kind of new and happening with ASCs right now.
Sure. Yeah, happy to. And the first ASC, I believe, was started back in 1970. So I know we
Wow.
kind of think about a new healthcare, and in a lot of ways, ASCs aren't new and the operating rooms aren't new, but the need for them has changed and evolved in such a meaningful way. And when it started, it was really independent physicians that were driving um, the development of ASCs, oftentimes as an extension of practice, and that's why they still kind of exist in the independent setting. The
Mhm.
DNA and the roots of the industry are with independent physicians. And that started as lower acuity things that could be done in the outpatient setting. So if you think about anesthesia, there
Mhm.
wasn't too much general anesthesia occurring initially. So a lot of cataracts, eyes, GI, lower, what we would consider today lower acuity was
Right.
somewhat revolutionary to be able to do in the ambulatory setting at the outset of the industry. And so it just kind of continued to evolve and have more use cases as pain management improved, as technology improved, as implants even improved for other surgical specialties. So
Right.
now there aren't too many surgical specialties that you can't do in the ambulatory setting based on where the industry has come.
So
And
Adnan,
now
let me
there's
let
about,
me let me just
yeah,
stop there. So that's a really, really you're right. Initially, even the idea of taking cataracts out of the hospital operating room and putting them into an ambulatory outpatient setting was kind of like revolutionary. Colonoscopies, right? You were pointing to GI.
exactly.
That
Yeah.
was like huge. What, you're not going to do it in the hospital, you're going to do it in an office practice out. And now, so what kind of surgeries are being done now in this outpatient ambulatory surgical centers? What extent of surgeries?
Yeah, so I'll kind of start with some higher acuity ones. What we're seeing a lot now of orthopedic. CMS has also now introduced the ability to do a lot more in the cardiovascular space. And
Mm,
some a lot in our
mm,
industry would argue that what's been approved by CMS probably is getting ahead of what can actually be done or what will be done
mm,
in the next couple of years, but perhaps in a forward-looking way, they gave it the stamp of approval. And then as you think about other things like robotic surgery is one that's emerging, but
mm.
all of kind of what you would consider bread and butter OR cases, so general surgery, GI, ophthalmology, gynecology, urology, all of these things can be done in the ambulatory surgery setting, and have many of those have been done for a very long time. The where we're getting now is the ability to do a little bit more. So, for example, sports medicine orthopedics versus total joint replacement. So, about 10 years ago, total joint replacements really took off. And that was a function of the ability to implant better in the ASC setting, the development of ASCs and larger operating rooms that could support
Mhm.
the clinical needs of the patients, could support the equipment, the C-arm, et cetera. So it's not that there's new specialties necessarily been added because they're all
Right.
covered. It's the nature of what can be done and the scope of what can be done that's truly expanded in recent times.
Cardiovascular. So, knee surgeries, total knee replacements, total hip replacements, spine surgery. That's been done for quite a few years and continuing. Cardiovascular, what kind of procedures are being moved?
Yeah, so initially we were seeing cardiac rhythm management, so pacemaker adjustments and things like that being done. There's a lot that can be done in office-based lab settings, which is a little bit different than ASCs, but very similar. But
Mhm.
now we're actually seeing more vascular work and higher acuity work being done. And a lot of the institutions that we talk to are thinking about it from a perspective of should we build something a little bit closer to our hospital. Like there may be some rules and regulations. Each state is also a little bit unique in terms of what they'll allow from an acuity perspective, particularly in cardiovascular. So people are still being mindful of these things that are a little bit nuanced there, but many are looking to cardiovascular as 10 years from now being a lot more commonplace in the ambulatory setting.
What is the advantage to the different stakeholders of moving these surgeries and procedures out of the hospital setting into a non-hospital office ambulatory surgical center? How does the physician benefit, the surgeon? How does the patient benefit? How does the payer, also known as insurance carrier, or if it's self-employed, how does the employer benefit? So, and also, if you can, a little bit, and you might want to save this until for a couple of minutes in terms of what how this impacts hospitals.
Sure, sure. So starting with physicians, one, it's a lot more efficient to kind of have your own space where you can perform care. So oftentimes, um, kind of having your OR block set up in a certain way, having your staff, consistent staff, a little bit better scheduling, and one of the hallmarks of ASCs is a bit healthier patients that qualify for the outpatient setting. So because you have a population that is a healthier segment, you typically also have less complications within those surgeries and are able to stay on schedule a little bit more. From
Mhm.
a business perspective, physicians oftentimes are invested, and this is their only avenue through which they can participate and collect facility fees in some form or fashion through their ownership. So it's a unique component there where it gives them a larger sense of ownership, whether they're independent or employed by a health system. It's
Mhm.
still kind of their personal investment. Um, so in many ways, it just gives them that sense of ownership, both literally and figuratively.
Mhm.
Um, for the patient,
Mhm.
talking about outcomes, there's a lot of statistics out there with respect to less infections, quicker turnaround, healthier discharge. All those things are typically managed better. And even on the same case that's done in a hospital, even if it's a same day surgery in a hospital versus ambulatory setting, apples to apples basis, it's typically viewed as an area where you'll get less infection, just given the ability of control and streamline that they have in the outpatient facility.
Mhm.
And
Uh,
then
in terms of,
what one,
yeah, in terms of
yeah, I think
cost
we're
and
headed in the same direction.
okay.
And this, I made that comment at the outset about, these facilities have now been around for 55 years.
Wow.
Um, the importance for them has gone up significantly for the stakeholders who are paying, right? So using the payer in the broadest sense of the term and using patients. So patient out-of-pocket cost is typically a fraction of what it is in the for the ambulatory setting relative to the traditional health system setting. So typically ASCs reimburse somewhere in the neighborhood of 40 to 60% of their neighboring health system in terms of the cost of procedure. So that has kind of a ripple effect. And as you think about one, just out of pocket cost, but now consumer trends, behavior, awareness about the differential between facility fees and hospital fees, informed consumerism has really shaped demand in a way where independent and health systems all kind of need a solution for those that are more cost conscious, who are looking at price transparency data. And then, of course, the overall cost of the system, as we all know, is highly problematic. And whether it's an employer, a payer, whoever's kind
Right.
of on the hook for the remainder of that expense will benefit from more utilization in the ASCs. So that's really driven it from an economic perspective. And it's kind of been this perfect marriage of the technology has evolved in such a way where you
Mhm.
can do
Mhm.
more.
Mhm.
And then the cost savings is there. And now there's a lot more transparency with respect to that cost savings. So now you're just seeing a lot more desire from every stakeholder you can think of wanting to have an ASC present.
Sort of my default notion about this is that hospitals aren't particularly big fans of ASCs because they do all the things you described. It's not that it's cherry picking, but it makes sense that you're going to see healthier populations and populations that actually can pay commercially insured in the ASCs, and so that sort of takes away the healthier patients from the hospital setting, takes away the paying patients from the hospital setting, and leaves the hospital with more complex cases, which require more cost because you have to have all the services around there to take care of the complex patients.
Right,
It just costs more. There's more readmissions, more length of stay, more medical care that's required for complex patients, and of course, taking care of patients that either have Medicare, Medicaid, or no pay. That all goes to the hospital. And so if I'm a hospital, system, I'm thinking, this is not the greatest thing. On the other hand, to your point, it's not a bad thing either because now if I actually get into it, one, I could own it fully or partially own an ASC. And I also think what you mentioned, I hadn't really thought about this from a clinical perspective and from a sort of an operational efficiency perspective. It makes sense for the more common procedures that can be, scheduled and, to put that in a certain place and put the more complex cases in another place. It's just a lot more efficient to run it that
right.
way.
And
So,
and
yeah.
there's a lot of value to health systems in doing that. Oftentimes to decant some of what we call decanting the lower acuity volume to the ambulatory setting. So I don't really view, a lot of times I think we see things in a very binary way. And I don't think this is one of those instances where health systems, there's a lot of advantages for them to have an ASC footprint. And we can always point to the cost differential or the reimbursement differential. But fundamentally, it would be less expensive to build an ASC if you had volume that you were opening up for higher acuity cases that may have to wait longer. So
Mm,
there's whole kind of secondary benefits with patient
mm,
satisfaction, addressing your backlog, and then cost avoidance with building out, instead of necessarily having to build on site at that hospital where you may not have
right.
the room, build a new tower where you may not have the complete demand. A surgical solution in the outpatient setting helps address a lot of those kind of capacity constraints through a
Hmm.
cost effective fashion.
It's really helpful in terms of background. There have been a lot of policies that have been and laws that have been passed now around the transparency, hospital transparency cost. So employers now can actually compare the actual prices between different hospital systems, different providers, comparing hospital A to hospital B, but also doctor A to doctor B. And again, is that something that, and that, by the way, is really recent, right? I mean, we've had some transparency laws in place for a number of years, but they haven't really had teeth. I think now we're beginning to see not only are they required, but also the technology is there for this data that's being put out there to actually be read. And there are companies that literally do nothing but help employers and payers take the data that is now required to be put out there and actually make it actionable and usable so you can compare.
Right.
So I would imagine that's a big impetus for the increase. And it almost feels like that would be like a bit of an inflection in terms of the growth of ambulatory surgical
It,
centers.
yeah, it really is. I think most stakeholders view it as kind of the for anything that's appropriate that should be done in an ASC should be done there. One other thing that's kind of changed too, that's worth mentioning is historically a management company, as you think about a management company would manage the site and they would make sure the site is running great. And the evolution that now we've seen with, I would say across the board with the segment that serve health systems
Mm,
is a lot more of a strategic thought partner approach in recognition of how important the service line is to the success and the future
mm,
of their partnered health system. So you're not just getting someone who's helping you, tell you how large your operating rooms are or kind of manage the day-to-day operations tightly. You're getting someone who's helping you with site selection, giving you advice, kind of investing alongside you,
mm.
and really kind of helping to drive to execution on the vision that you all are trying to achieve together. And that's really been a game changer, I think, for a lot of health systems that,
Mm.
again, having that dedicated expert is a great
Right.
thing in the facility, but having that dedicated expert and the thought partner and the experience
Mm.
behind growing a footprint is can change the game for a lot of systems.
Yeah, again, as I'm listening to you, I'm thinking that for hospitals and healthcare systems, this is you really made me think a lot more positively about it from a healthcare system perspective. I mean, this really is a opportunity to diversify your revenue. Um, again, reduce the cost of care for whoever's paying the individuals, the employers, um, uh, improve the quality and outcomes, improve convenience, safety, and again, for a hospital system, this notion of now another opportunity to get into the community, another channel, another source of revenue, especially in the emerging world of pricing transparency. It almost seems like a no-brainer. I'm always wondering, I mean, why aren't hospitals jumping on this even more than they are? I mean, if I was a hospital system now, given what, I'm learning from you, I'd be much, much more, this would be a higher strategy for me. And even the notion of, where you and I met was around direct to employer, right? And the notion of actually going out into the community, having this ability to offer this alternative, lower cost, high safety, high quality, with, the same surgeons, right? These high quality surgeons, as you pointed out before. It just seems like hospitals should be really jumping on this.
And they absolutely are. Like it's been a trajectory, I'd say like a steady growing interest over time. But if you look at the top 20 or top 25 health systems
Mhm.
by revenue in our country, probably one or two of them don't have an ASC management partner in there.
Hmm.
Um, and that kind of goes to show those who have all the resources possible are still choosing to bring a manager in. And the reason for that is how important it is and is how strategic it is because they want to accelerate their strategy or they want to make sure that the operations are run as efficiently as possible. All those reasons are kind of the proof points as to why it already is of high
Yeah.
emphasis. And kind of the last barrier that stands is kind of the financial step down, right, of being in an ASC versus on your hospital campus. And even that, with the passing of the tax legislation last year, with the increased chatter of site neutrality, and site neutrality is essentially the potential to equalize costs across sites of
Hmm.
care.
Hmm.
And so with that heightened risk, the one thing that some may hold on to say we don't necessarily want to flip
Right.
the switch quite yet is, maybe at more risk than it ever has before. And it's forcing people to kind of put that trade off on the back burner and think about the strategic imperatives and the benefits to the system that you mentioned. So today, now more than ever, I think we have people that are a lot more inclined to develop a footprint. And then the question isn't should we, it's just how should we go about doing this? Should we
Right.
do it ourselves? we bring someone in, what does that look like? Like those, the questions are in the how the strategy is or where to be or how to deploy, but less about if we should be. There's very
Yeah.
few service areas that would not necessitate the need for something like this.
Adnan, again, what a pleasure. I've learned, I thought I knew a lot about ambulatory surgical centers. I learned a lot more from listening to you today. Look forward to following up with you. And again, thank you for taking the time to speak with us.
Thanks so much for having me on. It was a pleasure to join you today.
Thanks, Adnan.